This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon.
I am a plastic surgeon, Amy.
You are?
Yes.
Yes. And this episode I'm super excited about. If you'd like to, there are a couple of slides. They're not all that interesting, but if you'd like to follow along on YouTube, you can find us at Jason Martin MD on YouTube. And while you're there, we would really appreciate it if you'd subscribe to our channel, hit that little bell for notifications, because we are desperately trying to make sure that everybody who wants one can get a Beauty and the Surgeon cup.
You just look on the video.
But
I mean, come on.
We have to be at 1,000 followers on YouTube before
we got a ways to go.
Before
so
we can
your
have
help.
a merchandise shop. So, if you're so inclined, please follow us on YouTube. You can also find us on Instagram at Beauty and the Surgeon podcast. And without further ado, this episode is a surprise for Dr. Martin.
Didn't know what it was.
Telling you all week, I've been super excited because I've been wanting to do this podcast for a long time. And we finally had a chance to do it. So people have probably seen these videos before, like where a celebrity will answer Google's top 10 questions about them. Have you seen those?
No.
Like Sean Connery answers 10 questions about him, and they are awesome. So I decided to pull up some Google search items and have you and I talk about them. So it's called Plastic Surgeon versus Google, but it's more like Plastic Surgeon.
So it's good I'm wearing my surgical cap right now.
That is good.
Okay.
Yes.
I'm ready. So I got to get focused. I got to concentrate.
You got to get your mind in the game.
Okay, I'm ready.
And just as an FYI to anybody listening, there is a massive thunderstorm happening outside right now. So if you hear some rumbling in the background.
Which is not bad because we're in the middle of a huge.
Well, we don't want the thunder or the lightning.
Well,
we want rain.
We want rain.
Yeah. Lots of fires in Colorado. But if you hear some grumbling, it's thunder, not like Google being angry at us. So, okay.
Listen, I got you, Google. I got you.
So, all right. So I asked Google,
okay,
are plastic surgeons? And these are the things that Google autofilled for me.
Okay.
So let's talk about this. Are plastic surgeons doctors?
I hope so.
Board certified plastic surgeons.
Right.
What does it take to become a plastic surgeon, Dr. Martin?
Oh, I mean, arduous training for 1 million years and giving up your life for about 15 of those years.
But I think this is an important thing to say is that you are a doctor first and foremost. So you go to medical school, you become a medical doctor.
Yeah. So it's 4 years of undergrad. Okay. And that's like your bachelor's of whatever.
Science, most
likely. Yeah. But yeah, you can do other things as long as you do your prerequisites. 4 years of medical school. And then after that, you do your training and what you want to be. The least amount of years you would train would be 3 years. And that would be like internal medicine or pediatrics. Most surgery residencies are 5 years. So that's 4 years of undergrad, 4 years of medical school, that's 8, plus 5 years, that's 13. And then even on top of that, people do fellowships like I did, which is another year or 2. So I think I went 14 years.
So you're like a super doctor is really what you're saying.
Totally super.
So you were a regular doctor, then you became a regular surgeon.
Yeah.
And then you became a plastic surgeon.
And then
you became a super plastic surgeon.
And then I did post-fellowship training on top of that in New York. But the point of all this is it's a lot of training.
It is.
And yeah, so there are people that just go to medical school and they're not a practicing physician. They do like bench research. So they'll do a PhD after that. Yeah, but plastic surgeons are definitely doctors. Is this these kind of questions? This is easy. I got this.
Right,
I was ready. I thought I was going to challenge Google. All right.
Okay, so a couple other questions. Are plastic surgeons rich? What was the? I feel like there's songs about that.
I mean, I felt like I was rich, in comparison relatively to my family and how I grew up. But then I moved to Aspen.
Yeah, then you realized you were not.
Yeah, I realized that.
You never will be.
Yeah, I mean, I'm rich, but come on, man.
Not Aspen rich.
Yeah.
So, are plastic surgeons essential? I think is an interesting question given the time this is being recorded.
That's
in
such a good
2020.
question. Yeah. Apparently they're not.
We weren't for a little while.
Yeah, when they shut things down with COVID.
The what?
Yeah, exactly. We're not supposed to say that word. What's the Harry Potter thing when you can't say?
I didn't read the Harry Potter books, but I know there is a thing.
Yeah, well, you can't say
Those
it.
He who cannot be named.
He who cannot
He
be
who cannot be
named.
named.
Yeah, it's the virus that cannot be named, so
That's
YouTube
right.
won't kick us off.
That's right.
Yeah.
We don't want to be demoted by YouTube after we just begged for YouTube followers.
Yeah, I know.
So, I think we had a big discussion about this, though, this year as to whether or not plastic surgery was essential. And I do agree that elective surgery is by definition elective. It is not essential.
Okay, so this is pejorative because it pisses me off. Because plastic surgery, the best thing about plastic surgery is you can do a lot of different things. All right. If you're an orthopedic surgeon, you got like 4 or 5 joints you can work on. Boring. Okay. If you're a neurosurgeon, you work on one thing, the brain or the spine.
Well,
right.
But that makes them gods.
But there's plastic surgeons are hand surgeons. They're cosmetic surgeons. They're reconstructive surgeons. There's burn surgeons that are plastic surgeons. Do we not think that burn care is essential? Do we not think that someone who chops off their finger that's not essential to sew your finger back on? By the way, that's a plastic surgeon most likely doing that, right? When we were shut down for the virus that can't be named, they wouldn't let us do breast reconstruction. They didn't think that was essential. I morally and logically oppose that because I think that if someone has a mastectomy, that reconstruction is medically necessary. So they were getting mastectomies and with no reconstruction, which is terrible, emotionally speaking. So I think plastic surgeons are essential. Governor Polis had a different thought in
Yes.
Colorado.
Well,
Shout out to Polis.
To
He's a
be
good governor.
fair, though, on paper, people think plastic surgeon does facelifts, orthopedic surgeon does knee replacements, and both of those things were shut down because orthopedic surgery is also shut down in the state. So, to be fair, it wasn't just us.
No, they were complaining just as much as I was just
Person
complaining.
who literally can't walk is maybe a little higher on the list.
You could
than
argue
someone
that.
who
I mean,
wants breast
obviously, the
implants
cosmetic stuff that we do.
Yes.
I mean, I get why that
is elective for a reason.
Right.
It's elective.
Okay.
Are plastic surgeons happy? Ooh, Google. Way to go deep, Google.
Oh, Google. That's painful.
Right?
Now, I'll say this. So plastic surgery is really hard, especially cosmetic surgery, because you cannot screw up. There's a lot of pressure on you.
Yes.
I tend to be the type of person that can handle that pressure, and it doesn't affect me personally. So yes, I am happy. But I do think that a normal person, that pressure over time can start to eat at you a little bit, right? I'm sure the same is true for someone who's like a pilot or, things that you have real lives in your hand, So there's no question that that can eat at you. But me personally, I'm happy. With that said, I personally think that plastic surgery is a happy profession because literally we make people happy, our patients. People are like, cosmetic surgery, what was that? I'm like, we transform people's lives. They are pumped up. We saw a patient today who looked at me and said, thank you. I am so happy for what you did for me. And that makes me happy. The patient's happy. I mean, that's happy.
Yeah.
And that's what we're selling is happiness. So yeah, I think plastic surgeons are happy, but I don't want to, I don't want to overstate it because it is a pretty stressful profession.
Yeah.
To stay on top of your game, you have to be physically fit. You have to be mentally fit. You can't deviate. You always have to push. You can never stop. You can never stop trying new things. You can never stop pushing the envelope. Even with digital media, everything, you just got to keep going and you can't rest. And that, I think, can be pretty arduous.
Yeah, can wear on a person. All right, let's see what Google wants to know about next. So then I asked Google, plastic surgery versus, and I think the interesting one, the very top one was plastic surgery versus cosmetic surgery. And I think this is a very common misconception that there's a lot of people who are offering cosmetic surgery and cosmetic procedures and cosmetic this and cosmetic that.
I mean, there's like literally boards that call themselves cosmetic surgeon boards, which are like weekend courses for people. That
Weekend
aren't
courses for non-surgeons
Right.
for the most part. Or, yeah.
We talk about this stuff a lot. And I don't know if anyone listens, and that's fine. But dude, when you're going to get your heart surgery, are you going to the guy who went to a weekend course, decided he's going to do your heart surgery? So why is it okay to let someone violate your body and they haven't trained? Like, what are you thinking? Is it cheaper? Okay, is $1,000 worth getting screwed up?
Right. Worth the
Yeah.
potential pain and suffering and or need for additional surgery from an actual plastic
makes
surgeon.
no sense to me. Don't do the surgery.
Yep.
Just save your money.
Go to a board certified plastic surgeon. Because as you talked about in the very first question, is a plastic surgeon a doctor? Yes. And they are a doctor that is trained far more than your general doctor or OBGYN who suddenly decided that they want to start doing cosmetic procedures.
There's not many surgeons that train more than plastic surgeons in terms of years. I mean, that doesn't make you good, but I mean, I personally would feel better to know that the mechanic who's working on my car trained like 5 or 6 years about motors than like 3 months. And it's not one-to-one. Now, are there non-plastic surgeons that do good cosmetic procedures? Of course. And there's talented surgeons in every subset, of surgery. But you got to play the odds on that. And you don't have the inside information. You're not like me in the OR, like listening to the nurses saying, oh, that doctor's really good, or that doctor's not so good, So you don't have that information most likely. I mean, maybe you could look at reviews, maybe you could talk to other patients, but what if they had a good day that day? And the other 3 days they have bad days, right? So you can't have a bad day. It's unacceptable. Right? But if you're only doing this on the side and your main job is delivering babies, then if you had a bad day, well, maybe I won't do that for now and I'll just keep doing what I'm doing over here.
Yeah.
So, wow, Google's really kind of getting into it.
Hitting some deep ones.
Yeah, I didn't realize this was going to be, I thought I was going to challenge Google on just terms, what is a rhytectomy? I'm ready.
So the next one was plastic surgery versus natural beauty. And this one got a little hard for me because, we talk a lot about that.
Go with you with the natural beauty. Is that a real search result or did you?
This is literally a screenshot of the search result.
I don't believe it.
Yeah. But, I think that is very true. And we try very much in our practice to enhance someone's natural beauty.
We care about that.
And really, I mean, we always tell people like plastic surgery is not going to make you someone you are not. It really isn't. Like, I mean, we have a patient who has like a permascowl and we did a great facelift on her and she still has the permascowl. And I just want to say to her, like, maybe just smile. Like, maybe just smile.
When you have that conversation with her, can I just kind of be around just to watch how that goes down?
Like, maybe if you just smiled. So we're big proponents of natural beauty, but I think those two things work hand in hand. We talked about plastic surgery.
Actually, so yeah, just like legit, when you're talking about aesthetic improvements, it's not antithetic to natural beauty.
Yeah.
Aesthetic improvements are there to enhance your natural beauty, right? So if you have an eyelid procedure, it's not to make your eyelids different. It's to make them kind of better, kind of the way you were when you were younger. If you were born with really small breasts and you wanted to have a cup size improvement, that's to enhance your breast and make you yourself better or more naturally pretty. Now, the problem is the word natural can mean a lot of different things. To me, natural means like you look good. You look like yourself. You look like it's meant to be. But natural, putting a breast implant underneath your skin is not natural.
No, I would say it's definitely not natural.
Yeah. So in that sense, but is doing elective surgery natural, period?
Yeah, maybe not.
Yeah.
That's why I said we kind of work within that. Yeah.
We're kind of on the boundaries of that.
Yeah.
Damn it, Google.
So let's talk about the difference between plastic surgeons and ENTs, general surgery, dermatology, ophthalmology. What's the difference between a plastic surgeon and an ENT?
Well, ENT is ear, nose, and throat. So they're trained on, what do you think they're trained on, Amy?
Ears, nose, and throat.
Oh, that's a
good
guess.
And ENT did my tonsillectomy.
Yeah. We work with Dr. Dickey in Denver, Colorado. Amazing surgeon. We love him. He's a great airway surgeon. And they're trained on ear, nose, and throats. So if you're going to your ENT for a facelift, you better hope they did a facial plastic, what do you call that? Post-fellowship or something like that. Yeah. But that's what they do. They do sinuses, airways, and stuff like that, tonsils, and some cancer surgeries. General surgeons, that's what I was trained in before I went to plastic surgery. Those are the yeoman surgeons of all of surgery. They're the ones that do appendectomies and cholecystectomies or take out your gallbladder, cancer surgeries. General surgeons make medicine work. So they're really good, but they're not trained on obviously cosmetic stuff for plastic surgery.
A lot of them do start doing some cosmetic procedures too. And I mean, they're trained in surgery, so they at least know how to keep a person alive.
Yeah.
Not kill them.
Yeah. If something bad happens, they could probably resuscitate you.
They can resuscitate you.
A dermatologist deals with the skin.
There's a lot of dermatologists who do cosmetic procedures.
Oh yeah, but we love the dermatologists that we work with.
Yes.
Dr. Stewart in Denver, she's amazing. So dermatologists are needed and necessary and important and really adjunctive. And I'm totally fine with dermatologists doing cosmetic treatments and procedures, but they have a tendency to want to step into more invasive procedures, and that can be a little bit problematic. With that said, when it comes to liposuction, one of the first inventors of liposuction was a dermatologist. So liposuction is kind of a carve out that dermatologists do, but we were getting into dermatologists doing facelifts and all these other things. I have a problem with that personally.
Ophthalmology, there's a big one.
They work with eyes. There's an oculoplastic surgeon. We have a great one we work with in town, Dr. Willoughby. But ophthalmology, by and large, deals with the eyeball. Okay, oculoplastics deals with the eyeball and the skin around the eye.
Skin and muscles.
Yeah.
The workings around the eye. Yeah, so there are differences. So it is important to find out, like if you're going to someone for a surgery, and maybe ask them what their training background is.
Yeah, it's not offensive.
No, they should
You're not
know.
asking what religion they are or what like sexual, preference they have.
No, they should be proud to
like,
tell you that.
Where did you train? Are you board certified? It's not, you're not going to get punched.
No.
And if they stutter or they don't have an answer, then you might
Maybe
wanna
Google whether or not they're board certified. You can find that out for any doctor. So ask them what board they're certified by, go to that website and search for them.
Yeah.
So if you can't find them, that's a big problem.
You can call Amy and just ask her.
Yeah, I'll find them.
Yeah.
I'll tell you. Okay. All right, Google. So next one is, does plastic surgery, fill in the blank, number one question, hurt?
Oh, so you just did like does plastic surgery.
Yeah.
And then you see what comes up.
Exactly.
That's so I totally get it now.
Yeah.
It's taken me to the past 20 minutes. I was like, I totally get this.
Yeah, so all I typed in is, does
this is
plastic
actually very
surgery?
brilliant. Yeah, I get it.
And
Okay.
then hurt.
Like, what are people really putting in there?
Right. So very first thing, does plastic surgery hurt? Some surgery hurts.
Yeah, it kind of does.
Yep. Yep.
But it's short lived. Like I can't think of a surgery we do that really has prolonged pain. Tummy tucks can really be discomforting for a while, but really it's well tolerated.
It is. Yeah, some surgeries hurt more than others. We've talked about how painful lipo is.
Breast dogs hurt.
Breast dogs hurt, lipo hurts. Like surgeries have different levels of pain. No, nothing, we say this, everything has a cost. And in most cases, the cost of your plastic surgery is financial, but it's also in downtime and in some discomfort.
Yeah.
It's gonna hurt.
I have a theory that it has to hurt a little bit for you to think it's working. Because that's like the human kind of mind.
Right, I don't feel anything.
Like if I
it's
just
working.
did a breast augmentation on you and it didn't hurt at all, you would almost be like, well, it didn't hurt, like. But
You
when
can still see the result in the mirror.
I know, but when it hurts, just your mind is like, okay, I just went through something.
Maybe. Yeah. So a couple other questions. Does surgery work? Disqualify you from the military was an interesting one. I'm like, that was one I hadn't really thought
Actually,
of.
I think that they do some breast augmentations in the military, don't they? For the
Yeah, it doesn't disqualify you from military service.
Yeah, okay.
There is not a plastic surgery that I'm aware of that would disqualify you from military service.
Okay.
That I'm aware of, and I've been very
even
closely
like top
associated with the
surgery and
military.
all that stuff. None of the.
Well, that gets into more than just the surgery itself.
okay.
There might be other reasons why you're disqualified from
Okay.
military service, but your surgery would not be the primary one in that
Okay,
case.
gotcha.
There's a good one. This is my favorite one. Does plastic surgery use plastic?
It doesn't use technically plastic, but it can use silicone, which is like a cousin of plastic, right? Technically.
Yeah.
Or polymers.
Polymer. Mhm.
Okay. We should call Nils' dad on that one. So
Where does the term plastic surgery come from?
I think it comes from the Latin-based plastique, like
mold.
mold. Yeah.
Yep, that is
And then
correct.
that was like taken from the French took that and like said, plastique, whatever surgery, however you say surgery in French. So it doesn't use quote unquote plastic, but it does use plastic-like material.
I have literally had patients ask me this question. Like, where does the plastic go? I've had people ask me that. And these are people who are having like a facelift. Okay. So people do think this. I had a patient call me and ask me
Are you
that to ask me
serious?
where the plastic goes.
Really?
Yes. What kind of plastic does he use?
That's so weird because, I'm a plastic surgeon. That's who I am. It's my identity. So I don't even think about the word plastic. But I get if you're not comfortable with plastic surgery, the first thing you would say is, why the hell do they call him a plastic surgeon?
Right. Where does the plastic go?
Is he plastic?
Is he made of plastic?
Is he made of plastic?
And I think some of it, maybe people think like you get that plastic look, like a plastic doll.
Yeah.
Where your skin looks like plastic.
It's not really a great name.
It's not. And
It would be better if they called us like art surgeons or molding surgeons, right?
Well, I mean, they technically are mold. It's just the Greek word. It's
Yeah.
all Greek to me.
Yeah.
So that's one I've actually had people ask me that. So that's why I brought this one up. This next one is really interesting. Does plastic surgery help body dysmorphic disorder? The studies actually say no. Surprisingly enough, like happiness and depression studies and rates of happiness, specifically in women who've had breast augmentation, that's one of the things that they've studied specifically in relation to BMDD and rhinoplasty. Top surgery for people to have BMDD are actually rhinoplasty patients. So it's an interesting thing. You know, anytime you're changing the body, people a lot of times put a lot of pressure on the result of this surgery, that it's going to improve their life. I mean, you know how many patients I've had say to me that they want a facelift because they need to get a rich husband? Oh, a lot. And as far as I know, none of those women got married in a short time frame to a very rich man. So people put a lot of pressure on the outcome of surgery as being something that's going to change their life in a way that's not realistic for surgery.
Mm-hmm.
You know, and in those cases, I don't think that that's maybe helpful for their body image.
You're taking away the whole mystique of plastic surgery. We're supposed to sell people a life change where your whole life is transformed
Right.
and everything is better.
But it can be. Like today you mentioned that we had a patient who was extremely happy with the outcome of her surgery, like said, thank you very much. I mean, so you have to take into account that there are
No, I'm being
always...
facetious. It's
Well, but people are people. And like if you struggle with your body image before surgery, and I actually said this to someone a couple weeks ago, like you probably need to get that under control before you think that surgery is going to fix this.
you can cut both ways. I do think that people, so plastic surgery definitely improves your self-image in most cases, but it doesn't treat the underlying cause of why you have self-image issues. And it doesn't treat depression.
Won't make your marriage better.
It doesn't make significant others like you more, or whatever. And I think that's the hard part, because you can't escape life, and plastic surgery is a great adjunct, but it's not going to change your life. With that said, if you go into plastic surgery with a really positive approach that's about empowerment, specifically for women, but men too, okay? It's about empowerment, about doing something for yourself to make yourself better. Just like, I don't want to compare it to going to the gym, but like doing something like that, like climbing a mountain or all these kind of things. It has that element to it, and it can be life-changing. It really can. It can change your mental perception of yourself and your life, for sure. But it won't change baseline problems.
Yep.
But plastic surgeons are not surgical psychiatrists. And once you recognize that, that's good. So you not only need to improve and transform your life physically, you need to do it mentally and otherwise. And Amy and I are proponents of that. We have been since the first day we worked together. We leave money on the table all the time because we tell people no. It's not going to solve your problem.
Yep.
And we're very honest with them too. We tell them, like, look, these problems are not going to go away even with plastic surgery. That's called expectations. The game of expectations, which if there's a new board game that's going to be made, I'm going to make that.
Plastic surgery expectations.
Plastic surgery expectations. Will this breast augmentation make my husband love me more? If you need a breast augmentation to make your husband love you, then no.
Yeah, there's problems there
Yeah, no.
that are not being solved by silicone.
Right. But it doesn't mean that it can't be transformative. It's just transformative in a way that's a little bit different than sometimes people think.
Yeah.
Empowerment and improving your self-image can transform your lives in ways you don't even understand, right? Just in personal relationships, jobs, and all that kind of stuff. But it's not going to take those essential things that you struggle with and make them go away.
No, it will not.
Yeah. Nothing will in life, to be
No,
honest with
that's
you.
just it. Nothing will.
Yeah.
So, does plastic surgery last forever?
Yeah, with me. Of course, Google.
That's good.
And if you Google, will plastic surgery last forever, Dr. Martin, there's only one webpage, and it's yes. There's only one word on it.
Is there a guarantee with that?
Yeah, guaranteed, 100%.
So the big thing that's working against all of us all the time is working against us the day of plastic surgery and the day after your surgery and the day before. Every day of your life is aging.
It's what Amy and I talk about all the time.
Cell senescence.
And by the way, our aging episodes don't get as much, viewings on YouTube, and I find that really interesting. And I get it because it's not as salacious, but that's actually really the most interesting thing we talk about.
Yeah.
Because we are actually surgically trying to alter what aging is doing to people in most cases, aging and pregnancy. And
well, that's aging too.
And if you could slow the aging process, then maybe we wouldn't have to do such large surgeries and stuff.
Or
You know?
if we could keep cells acting young for longer.
Right. You would just look better.
Yes.
And like
Or
your
we could stop gravity.
your laser treatments would work better. I know.
Yes. We could anti-gravity so no one's breasts droop.
Yeah.
Like all these things happen as a result of aging. So to think that plastic surgery is going to stop the aging process from happening forever is unrealistic. But that said, there are definitely surgeries that have a longer lifespan than others. So something like a facelift done well and done appropriately is probably going to last you 8 to 10 years. And in 8 to 10 years, if you don't care to look any different than you do then you're just going to continue to age and everything's fine. Like that doesn't mean that like your surgery expires and it all goes back. This is not a pumpkin. You're not going to turn back into a pumpkin.
Some policeman comes around,
Taking that rhinoplasty back.
Miss Jones, it's over.
It was in Spaceballs, right? That he
Give me
was gonna,
that face back.
He was going to give her back her old nose if the dad didn't pay the the ransom. So, in other surgeries
Did you just reference Spaceballs?
Yes, it is. Spaceballs, the movie. Yes.
And only Nils would know that.
I mean, I hope everybody knows that. Like Princess Vespa, give her back her old nose. Sucked all the air out of their planet. It was really sad. Okay, so there are other surgeries though that don't have as long of a lifespan, like a brow lift. Maybe 3 to 5 years because of the way the surgery is done, the anatomy of the area.
Some of the ways we're doing brow lifts now, I think last longer, but I get what you're saying. It's not going to last as long as a
It's not going to last as long. I mean, some people can do blepharoplasty or an eyelid surgery, time it just right, and maybe never need another one.
Yeah, we've seen a lot of people like that.
Other people need one in 5 years.
Yeah.
And a lot of that has to do with how your skin reacts, how you age, how you stay out of the sun, your diet,
individuality,
bioindividuality,
your genetics, your epigenetics, your environmental factors, your stress level, your sleep. Do you drink alcohol, your sun exposure? Should I keep going?
Yeah. The one surgery, though, that I would say is most likely.
It's like depressing. Like you start listing all these things. I'm like, is there any part of life that we're not insulting our physical bodies and causing us to age?
Literally, no. Don't walk outside today in Denver because ozone's really high.
I think. What about like one of those sleep tanks? No light, all relaxation. We were floating on top.
Yeah, unfortunately, your cells are still aging. And
Yeah.
they're still dying. The one surgery, though, that in most cases does last like quote unquote forever is a tummy tuck. If you have a tummy tuck and you don't regain weight again or get pregnant again, like your tummy tuck should last forever.
Yeah, that's true.
And so those things, or lose a lot of weight after, if your weight remains stable after a tummy tuck, you should not need a tummy tuck ever again.
Yeah.
So yes. So in some cases, yes.
So Google tummy tuck.
Yes. All right. So let's take a quick break to hear a word from our sponsors, and we'll be back in just a second. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah, and Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
Yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, we're back to ask Google a few more questions.
I'm ready for you.
You're
Google.
ready for it.
I'm
Okay,
ready.
so now that you get how this works, you're ready for the next
Like
one.
we could say George Bush, the Google.
The Google. Let's
it's
see.
a noun.
Yes. All right. So, what does plastic surgery
Do.
look like?
Okay, look like.
Mean?
What does plastic surgery
What
mean?
does plastic surgery mean? This is where we get a little esoteric and deep with Google.
We're
What
getting
does plastic
philosophical.
surgery mean?
Yeah. Well, I mean, it's a discipline of surgery, right? That does quite a few things, probably more than most disciplines of surgery. It's baseline. It works with the soft tissue, but some bones, like I do facial fractures, right? And at its derivation, it was about repairing injuries. Traumatic injuries, injuries related to cancer, whatever, kind of repairing those. And it's only been in the past 30 years that the cosmetic stuff has really become more prevalent.
Yeah.
40 years, past 40
Even
years.
still, I mean, it molds and sculpts the body.
Yeah.
Yeah. So the others on this one were plastic surgery costs. The cost varies greatly. Very often I get questions from people online asking what a specific procedure costs. And I will tell you this, at least with us, we are not a cookie cutter office. So the cost of surgery is going to be very unique to you and your needs. So
Right. I bet you the patients or the people are like, I'm not sure about that.
yeah. Well, then they get my quote and they see like it is very, and now are there things that like, have a pretty standard cost? Yes. But that's, not the majority of the types of surgeries that we do. We tend to do more complex.
Yeah,
surgeries.
there's definitely practices out there that like they focus on one or two surgeries types, like breast augmentation and this, and they get
$5,900. Get your breast out
there you
here.
go. That's good. It's the same thing for everyone.
Yep.
Well, no, it's not. Okay, but I guess that's the way they do it.
Yeah. So a lot of people do.
Yeah,
What does plastic surgery feel like? Depends on what you're having done.
yeah, I know.
Yeah. We had a patient tell us once, this was an awake procedure, tell us that liposuction felt like there were tiny men under her skin with knives.
Yeah, that was interesting.
I also had a patient tell me that the sutures around her ears from her facelift incision felt like she had spiders crawling in her ears.
Do you remember the guy who had liposuction and just was so fearful to call us because he felt like his testicles were swollen
Yeah.
because the inflammatory fluid had gone down to his scrotum?
The really funny thing was he called and I answered the phone and he asked if Dr. Marr was. I said, well, he's in surgery. Is there something eye cancer? And he's kind of got really quiet. I'm like, anything at all? I said, you got some weird bruising you want to talk about? Because I just knew that's what it
You
was.
knew what was going on?
Oh, I knew. As soon as somebody says they want to talk to you and it's a guy, and then he got really quiet, and I'm like, you got some.
It has to be about his penis or his
Well, I
scrotum.
said, like, have you got some really intense bruising in your scrotum? And he's like, well, it's like purple. I'm like, yep, that's bruising.
When I saw him after that, he was like, I didn't believe her, man. I thought I was totally screwed. I'm like, no, it's like pretty much everyone has the
Yeah.
same problem.
Yeah. So feels different to everybody. I mean, it's kind of like I tell people, like, I'm never going to tell you that something doesn't hurt because pain is subjective. So I'm not going to tell you that this doesn't hurt or that you should not be feeling pain. So it's going to feel different to everybody. But, tiny men inside you with knives or spiders in your ears, there's some weird stuff.
There's some weird stuff.
Yeah. Feels different. Okay. How does plastic surgery,
Okay.
we've really talked about how plastic surgery works.
Yeah.
We've talked about how plastic surgery ages.
Yeah. Yeah.
Financing work, that's going to be different from every office.
Yeah.
How it feels.
Yeah.
The cost we talked about. Make eyes bigger. These two at the bottom were my favorites. How does plastic surgery affect the environment?
What?
This is Google. This is Google coming up with this. How does plastic surgery affect the environment?
I don't even want to answer these questions because I feel like I'm going to get in trouble. I mean,
It's an interesting question, though. Something
Yeah.
I had never really thought about. I mean, we do have medical waste that comes.
we
because
definitely
of
have
our
medical
surgeries.
waste, and
Yeah.
also breast implants don't
They don't decompose.
decompose.
Nope. So
That's very interesting.
yeah, we create waste, not tons. I feel like our office does a really good
Well,
job.
I think the better way to look at this is how green is the beauty industry, and it's pretty poor.
Yeah.
Right. So to be very honest with you, the beauty industry does not use a lot of recycled materials. A lot of the chemicals that they use in these products aren't so great. And I'm talking about just products, topical products, but aren't the best for the environment. So, that doesn't really fall under in our personal practice because we tend to the products you get tend to be pretty well sourced. But yeah, it's really not great, to be honest with you. I've never even thought about that question.
right? It's an interesting question, Google.
Google.
Followed by, this
No.
is where Google gets
I'm not
so
answering this.
deep.
I'm not answering this.
How does plastic surgery affect
No,
society?
I'm not going to answer this right now.
But it's an interesting
Not in this
question.
political environment. No way. No.
No,
how.
well, I mean, let's talk about in general. We talk about a lot of surgeries. We recently did an episode about BBLs, Brazilian butt lifts.
Yeah.
That, when BBL first came out, Dr. Barr and I both thought people were referring to the laser treatment that was called BBL.
Yeah.
So absolutely, I think it's more so that, yes, plastic surgery does affect society in what people view as normal. And we've talked about this in a positive way, though, in our episode about rhinoplasty recently, when we did Rhinoplasty 2.0, where we talked about the decrease in numbers of rhinoplasty is, yes, maybe because ENTs are doing more of them, but also because maybe it's people are becoming socially more accepting of unique noses.
Yeah.
There's not as much cultural pressure to have your nose look a certain way or, really those fundamental changes.
Yeah, but if you were doing this podcast in LA with a plastic surgeon like me who caters to the stars and stuff, they would answer this question totally differently. How does it affect society? It helps society. We guide people aesthetically with their beauty, and we set the trends for the future and stuff like that. That's what they would say. I don't believe that. I think the trends of society and like you're saying, the way where it's pushing, if it's coming from the masses, it's not coming from the leaders and the creators. They're responding to what people want, I do novel things, don't get me wrong, right? But I'm not changing society with those novel things.
Right. But overall, and I'll tell an interesting story. So I was at a small gathering, a socially distanced gathering recently, and people always, when they ask me what I do, eventually it comes out that I work for a plastic surgeon.
Right.
So we were talking about surgeries, and it was just another woman and I, and we were, kind of sitting next to each other talking, and we were talking about, men getting plastic surgery. And, I brought up that, the surgeries that, yes, are pretty common with men, that we have a large proportion of men doing surgery with us. And then we started talking about, vaginal rejuvenation, how it's becoming so much more of a thing. And it's not becoming so much of a thing for scrotal rejuvenation and to have your scrotum tucked and to have other types of things. And at that point, one of the men who was there kind of overheard this part of the conversation. And what are you guys talking about? So we said, you were talking about labiaplasty and vaginal rejuvenation and versus, why men are not getting
Scrotal
their balls
Pexies,
tucked.
yeah.
Yeah. And one of the men actually said, well, that's because some women really need to get that figured out down there. Ooh.
Oh, that guy didn't know who he was talking to.
But that's kind of my point. There are things in society that put pressure on specific genders, being women, to look a certain way in a way that is probably not actually helpful to anyone, but is societal pressure only. And I would say a labiaplasty is really high up on that list.
Right. So
Now-
to be real clear, I feel like I'm always correcting you right now.
Okay.
So there's functional labiaplasties.
There is. That's a very small.
Well, you don't know that.
Yes, I do.
Okay. There's functional labiaplasties for people that have pain, discomfort, and functional problems.
Right.
There is cosmetic labiaplasty, which is the majority of them, which is odd, right? That this is becoming so prominent, and that's definitely coming from society.
Right.
That's not being thrown back from the experts that are doing these things, but they perpetuate some of these things too.
Yeah.
And then it becomes normal.
Right. And that becomes normal
Yeah.
or becomes expected.
Right.
So I think, and that's just an example in society right now of something that is definitely not, even something that people on the street are going to see about you, but that is very much a society pressure on people to look a certain way.
Right.
That is directly affected by plastic surgery.
Yeah.
So how does plastic surgery affect society? I think it's more like, how does society affect plastic surgery?
Very deep.
Like, we do the surgeries that
That's
people
like
come to us
Asian
asking
philosophy, throw it back
Yeah,
at you.
it is.
Jiu-jitsu, use the punch and
Right.
hit it back. I got you.
for. Yes. For those of you out there with like very large labia, I do, feel sorry for you, and we should come in and get that fixed.
Yeah,
But
we know.
I'm not trying to shame anybody. in
No,
that big
I know.
labia.
And that's the thing. That's where it
Now,
gets,
there are some men who could definitely pull that up. I am shaming you guys.
Yeah.
If you go to the bathroom and your balls touch the water, come see us.
So,
I have no slide for that.
okay. That would be great if we became the experts on.
I mean, why not?
Scrotalpexy.
We could affect society.
It's super easy. I could do that surgery right now. I already know how I would do
Small incision, you just
it.
pull it up.
Yeah,
suture
pull it up.
It would be
Deepithelialize?
easy.
Okay,
Yes.
let's do it.
We could affect society, Dr. Martin. We could affect change.
That's what our next episode should be about, the potential for scrotoplasty
Yes.
in America.
And why it should be done.
Okay.
Why
good.
everyone needs one.
All right.
Yes. So, one last slide before we let this go, because these were important. So, this was, can plastic surgery?
Yeah.
Can plastic surgery get rid of scars?
But man, all these questions kind of have like a both answer.
Yeah.
Yeah. They can make scars a lot better.
Yes. And it's you can improve the appearance of a scar. Absolutely.
Yeah.
And how visible a scar is. What episode do we talk about scars? Do we have one all about scars? Scars. Yeah, we have one about scars where we talk about how scars heal, why some things have scars and others don't. If you get a paper cut, it's not like your hands
Oh yeah, that
are.
was last year.
Yeah.
Yeah. Okay.
It's not like every injury you've ever had in your entire life is like riddled on your hands, but you get scars from some things and not others. And
Right. But plastic surgery could definitely make them look better. Aesthetic treatments can definitely make them look better. You can't make a scar disappear though.
yeah, this one I think is the
Actually,
most.
you can make a scar disappear, but you're going to end up with another scar. You can remove it
Right.
and with a tummy tuck, but you still get a scar. With
There
the
is
skin
still a
in it.
scar.
Yeah, some sort of scar.
This is the final question, and this one I think is probably the best one to talk about. Can plastic surgery be reversed?
Oh. Some of them can, some can't. A breast augmentation can.
But your breasts may not ever be the same. If you
Right.
do it 10 years later, you're never going to go. What I tell people is this: you will never be able to go back to the day before surgery, ever. Not that you would ever want to, but you can't. Now, can things be somewhat turned back to the way they were before surgery? Sometimes.
Yeah.
But is that going to be a one-to-one?
Right.
Rarely. Yeah.
I mean this honestly. I can't remember a patient that wanted to really truly reverse.
And I think that comes though from us having a mentally healthy patient population
Right,
too.
right.
We don't have people that come in and have severe remorse from their surgery because we're not doing outlandish weird things.
Yeah.
We're making sure that our patients understand and what to expect from surgery. What they can expect to look like, to feel like, to have their life be like. And we're doing things that are really making people's lives, enriching them, making them better. But I think if you were working with someone who maybe had some body dysmorphia, could they potentially wish that they could go back? Maybe, because in their mind, going back might make them feel better in some way.
Yeah, for sure. Yeah.
So know that. And I do tell people this, like, you can never go back to the day before surgery.
Well, I mean, humans in general with decision making is terrible.
It is.
Yeah.
Yep.
It's always emotionally ridden, and they tend to make the wrong decisions sometimes.
Yeah.
That's why we talk to patients so much and really like try to logically work through it. And patients really want a lot to really talk about emotional things, and I listen and I entertain that, but then I push that to the side. I say, okay, now we're going to take this emotional conversation over here, and now we're going to talk about real stuff. Now, your body, what we can do, what we can't do, what that means, what the risks are, what that cost for you to do this, what's the recovery, how's that going to affect your quality of life in the short term. So those things is kind of how you get around that stuff. And then I think once you get through all that stuff, people tend to make the correct decision
Absolutely.
for them.
Yeah. But once you've taken off skin, once you've, had bone shaved off your nose, like those things are never coming back.
No.
So that's why it's really important to go to a board certified plastic surgeon, or a super surgeon, as we're going to start calling you. Super surgeon.
Exactly.
Because you really are. You're like a surgeon times 10.
Yeah.
So going to a board certified plastic surgeon, really having a good idea of what to expect, having your expectations realistic, all that stuff.
I can't believe you didn't ask me, can plastic surgery make you taller?
That's one of them. Can plastic surgery make you skinny?
Can plastic surgery remove cellulite?
I jumped over that one because, oh my goodness, Google.
Man.
If you could fix cellulite,
Let's
Google.
do that.
Yeah.
Oh, yeah.
Make your eyes bigger. I mean, there's a lot of questions. So these were just a few.
That was good.
And
I loved it.
Yeah, I've been wanting to do that with you for a while. So I think next time we'll do it like GQ style, with you in like a white room with the flashcards. I'm gonna make some big giant flashcards with the
Yeah, what is that? I've never seen that.
Oh, you got to look it up. Yeah.
Okay.
Yep.
What was the one where they walk through the different rooms? They're walking around asking them
That's
questions.
Vogue.
Is that Vogue? Okay.
72 questions.
Yeah, 72
72
questions. Yeah.
questions.
Those are cool.
Yeah, those are good.
Yeah, but like you search like your favorite actor and like answers the internet's most popular questions, answers Google's top questions.
Yeah.
So they're good times.
We should do that for sure.
Yeah. So thank you everyone for listening. I know this was a little bit of an out there episode, but definitely if you wanted to learn some of the intricacies of plastic surgery, this was a great episode to learn.
And if you're a man out there struggling with your scrotum,
Come to us.
we are here for you.
We're gonna patent that ball tuck.
We're gonna change society. We're gonna make this Vogue.
That's right.
In Vogue. All right. I appreciate everyone listening. Did you give all of our handles?
I'm going to right
Okay.
now. So we have something really fun now. For those of you who've made it this far in the podcast, we assume that you are hardcore listeners and you would love to have your question answered on air, in which case you can leave us a voicemail. We have a voicemail box set up. Get your pens ready at 303-630-9038, and that will be in the show notes as well. I still don't have
We're cool with
memorized.
pranks. I like pranks. I mean, Amy will play them to me.
Please don't prank me. So we'd love to hear your questions, comments, all that good stuff. Please leave us a rating review. We'd love it if you could follow us on YouTube as well. That would really help us out and help us get some merch out to the masses. You can find us on YouTube at Jason Martin MD and on Instagram at Beauty and the Surgeon Podcast. We appreciate you all listening so much, and we will see you next time.
Yeah. See you later, Google. Got you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.